Good evening to everyone and welcome to today's session. Roshan Yadav, Nagesh, Commandant, Alek Seth, Balakrishna, Akireddy, Saumi, Venela and many more across the country. Can you please punch whether the voice is loud and clear? Tomorrow is the D-Day, the day which we had been waiting to fulfill our aspirations. It is the same evening for the guys who are going to become the toppers, for the guys who are going to have few clean bowls, and for the guys who could not give their time last year. For everybody, the evening is the same evening today. And everybody is a human. Please let me tell you. There is no one who can be called superhuman or has got an enormous capability or anything. It is just the perseverance, conviction, commitment, and a trust and faith on oneself that I am going to win the game. Unless we trust ourselves, unless we trust our hands, our eyes, our heart, our mind, our amygdala, and feel that I am the one who is going to be topper, who else in the world can make you perform? So that is the reason, let me tell you that go with only one hope that I am winning, like a surgeon entering into an OT to do a cardiothoracic bypass surgery. Cut your heart and check whether you can be able to answer 300 questions strongly. Like a neurosurgeon, think yourself, can I be able to cut into the brain and take out the tumor or not, knock out the tumor or not? So if you start doubting, can I be able to open the calvarium? Can I be able to see the brain? Can I be able to stop the bleeding? If you suspect, if you doubt, if you stop yourself, that is the point where no one can be able to help it. So, let me tell you, you all prepared well. Every evening, you have shown your conviction, commitment towards the aspiration of getting a good MD seat. You have shown that in the last nearly 2.5 months. We all have journeyed together for nearly 100 days. And in this 100 days, you have solved so many quizzes on this floor. So many questions you have solved. So many times you were clean bowled. So many times you went back and opened the book and then reviewed at least 2 to 3 topics where you were clean bowled. And every Sunday, religiously we had been discussing the full-scale grand test and having a discussion 12 to 3. And that made you to know how to use the common sense for answering those questions where you didn't prepare well. So, think all those wonderful moments that we have spent and try to appreciate yourself before the mirror. You will be the winner. So, to start, I just wanted to ask 90 short topics. 30 in medicine, 30 surgery, 30 gynops. 90 questions, let us play the tambula. These are all the most top 30 high yielding topics. And let us check how good you will be able to answer. If you answer wrong also, don't worry. Tomorrow's exam also will be like these short topics only, let me tell you. Okay, so let's start the game. Unfreeze your fingers and get ready to fight. HIV, without that there is no question paper in the tomorrow's exam, doctor. Let me vouch for you. These are all the short topics. Let us start the tambula. Please punch your answers. Right? Now, Most prevalent subtype of HIV in India is which one? May not be the same question will come. I'm not saying the same question will come. At least I'm not a fool to say that. From our question bank, X number of questions came. But HIV is something which आखिरी अंतिम दर्शन करके जाना है एग्जाम को. Right? Right. Very good. Nagesh, Roshan, Saloon, Saumi, everyone is betting on subtype C. Absolutely right. HIV, two major classes, 1 and 2. Subtype C virus of the M group is the most prevalent one. Now, doctor. The second short topic without which there will be no NEETPG 2019 tomorrow is the cerebrovascular accident stroke. Now let me check. आपकी अंतरात्मा से पूछो मैं कितना अच्छा पढ़ाई किया. These are all true statements about the watershed infarcts except what? In the cerebrovascular accident. Shoot your answer, doctor. Monica, Vipul, Surya Prabha, everybody. Very good to see 104 at least. At least. Today, I want to see all the 400 students who used to come at different times. Almost 400 unique students who were the part of our journey. You are betting between C versus D. Shubham Gandhi is proposing D. But nobody proposed B. Oh, Ismat has proposed B. Congrats, Ismat. Proud of you, right? Ismat, excellent. So, this is the cortical border zone between ACA and MCA and between the carotid artery and middle cerebral artery and the posterior cerebral artery, the typical border zones. So this is the internal watershed zone. As what you can see, this is the typical area where you get the watershed. Yes. So these are the other areas of the watershed infarction on the MRI which you are able to see. And the watershed infarcts mainly are because of the anatomical territorial distribution, hemodynamic changes, high altitude, they are all the predisposing factors, and the vasospasm. And I leave the literature for you, which is already many times we discussed. So, whenever watershed zone infarct occurs, there is a kind of an encephalopathy where patients have a cognitive deficit, visual agnosia, etc., that will show up. Now, the third short topic, without that there is no question paper in the tomorrow's NEETPG 2019 is acid-base disturbance. In the metabolic alkalosis, you see all these things except what? Metabolic alkalosis. When you are dehydrated, will you get metabolic alkalosis, or when you are overhydrated, will you get it? That is an important clue in this story. So in a severe metabolic alkalosis, what are all seen except? Question number 3. Ravi is betting on hypocalcemia. Oh, Ravi. Then Kanumuri is proposing pulmonary edema. Ismat is betting on hypoxia. Shubham Gandhi also, very good, pulmonary edema. And Rocket Trader is a to the power of 10. That is called confidence. मैं इसके पहले बोला ना डॉक्टर, अगर आप डिहाइड्रेट हो गया तो रीनल परफ्यूजन कम हो जाएगा. This is one question you should not do wrong when you are with Dr. Murali Bharadwaj. Please give me the board. Give me the board. Huh? Yeah. Whenever you are dehydrated, क्या हो जाएगा? There's a decreased renal plasma, renal perfusion. then that will stimulate renin-angiotensin, and that increase the aldosterone, and aldosterone in turn will go, and what does it do? What does it do? It leads to the retention of sodium and loss of K plus and H plus into the urine, and loss of H plus lead to the metabolic alkalosis. How do you treat it? You will administer saline, you will replenish the renal perfusion, and you stop this from happening. So, a dehydrated guy is the one who has metabolic alkalosis. Pulmonary edema occur in which context? Dehydration or overhydration? It occurs in the context of overhydration is what you have to basically remember. Beautiful. Good. Ubiquitous is your junior who love to say to all the senior annas that bhai इस साल आप खत्म करो, अपना अपना सीट ले लो, नेक्स्ट ईयर हमारे साथ compete मत करो. मैं भगवान को प्रार्थना कर रहा हूं कि आप सबको सीट मिल जाएगा ताकि आप कल नेक्स्ट ईयर हमारा कंपटीशन नहीं बनेगा. यस, दैट्स राइट. नाउ द नेक्स्ट टॉपिक, sure short topic for the NEETPG 2019 will be the neuropathy. Let me check how good you are able to do. What is the anti-epileptic of choice if there is a diabetic patient who is having peripheral neuropathy is the question of the examiner. Should you answer, doctor? It's a very easy question. All of you answer. All of you should answer. Ravi, the surgeon, MS General Surgery is saying pregabalin. Commandant also, Jaideep also, Ashima also. Very good, very good. Absolutely right. It is pregabalin is what you need to remember. Now, the next sure short topic, question number 5 in NEETPG 2019 is going to be anemia. Hemolytic anemia. Alexander Korna. The name Alexander reminds you of courage at the time of war. Dr. Alexander, from which part of the country or Greece are you from? Are you from Kerala, Alexander? So, from which part of the country, Alexander, and what branch Dr. Alexander is dreaming in the tomorrow's NEETPG 2019? Alexander is going to tell now. Very good. I can see D versus B. You are all debating between B versus D. Sudipti, our Telangana, pride of Telangana also is saying D. Let us check. Absolutely right. So, G6PD deficiency, pyruvate kinase deficiency, hereditary spherocytosis, they are all the intrinsic red cell defects is what you have to remember. Good. Alek Seth is MD General Medicine. All of you know, right? So don't ask for, leave a seat for Alek. Yeah. So, that's right. Now, the next topic, not sure short, but possible topic for tomorrow is cystic fibrosis. Should your answer? The most common organism leading to the pulmonary abscess in cystic fibrosis is which one? Is the question of the examiner. Cystic fibrosis, because today modern world is all about molecular diagnostics. That's the reason examiner can have a very good eye on cystic fibrosis. Question number 6. Most of you are saying A. Danish Isas is on C. Khanna Jaideep also is seduced by the option C. It is A. Most common it is being said. So it is Pseudomonas or Neugenosa is what need to be remembered. Topic number 7. Sure short topic for NEETPG 2019. ECG. एक ECG के बिना अगर पेपर है तो हम मुरली भरद्वाज के पोस्ट को त्याग पत्र दे देंगे, right? So ECG, let us see. ST segment elevation, other than myocardial infarction, there are many other causes leading to ST segment elevation. These are all the causes except is the question of the examiner. Come on, let us shoot. What is your answer? ST segment elevation in ECG is not seen in which situation? Question number 7. Ravi thinks A, Ritvik thinks C, Jaideep is on hyperkalemia, Kulkarni is on hypocalcemia, and Pramod is on hypothermia. Let us see. So all causes you should be sure. Who said C? Surya Prabha, Anuj Nigam, Tunu Bhatriya, Jindabad, Gulam Bhatt, Jindabad. So typically you have a PR segment, ST segment, ST elevation and ST depression. Now, what are all the causes other than acute MI where you can see ST segment elevation is an important question. So you should remember left bundle branch block is one important situation where you can see the ST segment elevation. Then ventricular hypertrophy. If there is any aneurysm after MI, the left ventricular wall become weakened and that lead to aneurysm and that presents as a persistent ST segment elevation after an MI. Then any injury like a contusion to the heart or acute MI or hypothermia may, the Osborne waves that you see are also ST segment elevation is what you have to remember. Can you give me a different yeah. So this is how you appreciate the T-wave inversions in case of subarachnoid hemorrhage. Other than MI, what are the causes of T-wave inversion? Subarachnoid hemorrhage patients there will be diffuse T-wave inversions. Then, what are the causes of T-wave inversion? Ischemia, ventricular hypertrophy, ectopic foci, RBBB, LBBB, digoxin, anything can lead to. Similarly, depressed ST segment. Other than generally depressed ST segment is a sign of ischemia. Other than the ischemia, what are the causes? So this is how examiner can ask. Then generally lead V1 में positive R wave नहीं रहता. V1, V2, V3, V5, V6 you will come towards the left side. Left side में always R wave will be there in the QRS complex. Right side में नहीं रहता. अगर रहे तो if there is a R wave in V1, what are the causes? WBW, old MI, RBBB, dextrocardia is what you have to remember. The next sure shot topic for the examiner, endocarditis, everything you should know, infective endocarditis. These are all the diagnostic criteria of infective endocarditis except what? Shoot your answer, doctor. Question number 8. Sure short topic, yes. Very happy to see 136 online students tomorrow's exam and today you are ready to play tambula. It's a good sign, let me tell you. जितना cool रहोगे, जितना ठंडी दिमाग से आप operation करोगे, think like a surgeon going to the operation theater tomorrow, like any other day. Even if you have to do bypass surgery on Prime Minister of India also, still he's a patient, you're a doctor. Will that be anything different? Will that day be anything different? Will you hold a different scalpel? No, it is the same scalpel. So tomorrow is also the same day like today. So positive blood culture, positive echocardiogram, fever more than 38. So all the major and minor criteria of the Duke's criteria, you should be 100% sure. The next sure short topic, without that there is no NEETPG, is epilepsy. What is the characteristic feature of the EEG in the petit mal epilepsy? Question number 9. Shoot your answer. Yes, shoot your answer. Petit mal epilepsy absent seizures classically are identified by what type of EEG? That's right. Ravi, Tiwari, Monica, Shubham, everyone is saying 3 to 4 Hz spike and wave activity. Then question number 10, topic number 10, countdown. Sure shot in tomorrow's NEETPG, Parkinsonism. Now my question is, Parkinsonism किस metal के वजह से आता है? It is associated with which metal is the examiner's question. Question number 10, shoot your answer, doctor. Ravi is proposing molybdenum. Vanilla thinks selenium. Tiwari thinks manganese. Roshan Yadav, Gulam Bhatt, Alexander. Alexander did not tell me from which place and what branch he loved to have. Prajakta also thinks manganese. Absolutely manganese. Right? So, smart. Shuffling eye, mask-like faces, bradykinesia, echinacea, rigidity, tremor. In terms of Parkinson's, you should not forget. Then what are the various drugs? Salad, salicylene, anticholinergics like trihexyphenidyl and benzhexol. Then L-dopa and carbidopa or benzazide. Then amantadine and bromocriptine, lyseride and pergolide like dopamine receptor agonist is what you should not forget. Now tell me, doctor, how many of you made 10 out of 10 in the part 1 of our tambula? 10 questions में 10 का 10 कितने लोग किए हैं? नहीं किए तो at least 9 by 10 कितने लोग किए हैं? Please shoot. Very good. Rocket Trader 9 by 10. Roshan Yadav is 8. Ravi 6, no problem. Right? Ismat is 7 by 10. Nagesh is 7. Very good, very good. See, always self-assessment. Self-assessment helps a lot. Now, let's see the next 10 questions. Aapka test your preparedness. Okay? So, vasculitis, without that there is no topic. About Kawasaki disease, what is accept about it? Do you see in children? Do you see coronary involvement? Are there any mucocutaneous lesions? Is there any suppurative lymphadenopathy? Beautiful question. Kawasaki 11. Alexei thinks D and Tiyanga Devi is thinking suppurative lymphadenopathy and Yuvaraj is thinking suppurative lymphadenopathy. Badia. It is suppurative lymphadenopathy is except. So mucocutaneous lymph node syndrome is given to Kawasaki. It comes prior to age of 5. Coronary vasculitis, heart attack in a child is the presentation. And you find bead-like aneurysms. It is very benign and self-limited and uneventful recovery will be there. High dose IV immunoglobulin is considered to be the management of choice. The next short topic for tomorrow's exam is very good. Alexander is from Hyderabad. Superb. So, brain stem stroke. Let's talk about this. Lateral medullary syndrome of Wellenberg. What is except? You're all going to kill the answer. I know that. Right? Because many times we discuss brainstem syndrome. Many times I have excited you to and reminded you to go back and read. I am very sure you might have read well. Everyone is saying D, but Ismat is on A. Mohsin is on A. And Chirag Tiwari is on A. Good. So, it is D, doctor. You don't get a shoulder drooping because of lateral medullary syndrome. You have 5th, 9th, 10th, all of them are very much involved. So, spinothalamic tract, because of the 5th nerve involvement, what happens? Ipsilateral pain and temperature sensation of the face is gone. That's what you need to remember. Now, Guillain-Barré syndrome, without that there is no paper. The next sure short topic. Regarding the treatment of the Guillain-Barré, what is except? Let's shoot the answer, doctor. Question number 13. About the treatment of Guillain-Barré, what is except? Quickly. Oh, glucon D, please don't get depressed as the questions progress. The whole idea of the today's congregation is not the purpose to depress, but to see how well we can use the common sense in the questions where lot of questions में common sense का इस्तेमाल करना ज़्यादा पड़ता है. It's not a sure short answer. How many Guillain-Barrés have you treated? After all, right? So, Sudipti is proposing D, but yay, Nagesh, Chirag, Balakrishna, Soumi Mandal, everyone thinks yay, corticosteroids are of no use. The next sure short topic is leukemia. Leukemia. Let's see how good you will answer. Rods are abundant in which subtype of AML? This all of you will kill the answer, I know that. Question number 14. 14. So, this is that subtype of AML which has the best prognosis. Highly responsive to retinoic acid. Okay? Very good. Glucon D. देखो, आप right answer किया, ऊपर से depression आ रहा है बोलते. Come on, Mia. Huh? So, M3, very good, very good. देखा? So, almost 80% of paper skating, ऐसा ही biscuit questions रहता है, right? So, ये और जो होता है, it is most frequent in M2, but you classically see it in M3 is what you need to remember. The next topic, sure short, is polycythemia. Guys-Bokk syndrome, what does it consist? What is Guys-Bokk syndrome? Question number 15. I'm sure all of you are going to crack this question correctly. Very good. Ravi is proposing A. Good. And Sudipti, everyone is on A. That's good. Spurious polycythemia. Vanilla clean ball. Nagesh clean ball. Now, doctor. High altitude erythrocytosis. When you go to high altitude, it's called Monge's disease. And spurious polycythemia is Guys-Bokk syndrome. Now, the next topic, sure short topic, without that there is no question paper. Pulse. Pulsus bigeminus, where do you see? Is my question to all of you. Come on. So, still you have a wonderful time, doctor. One wonderful night is there. Agar is 90 topics I am going to ask you questions. अगर कोई टॉपिक में अगर आप आंसर रॉन्ग करें तो 5 टॉपिक खत्म करके सो जाओ, कल जाके एंट्रेंस लिखो. 5 जरूर आएगा. वो 5 करेक्ट आंसर करेगा आप. 5 is all the difference between winning and losing. Okay? We are having a diagnostic test now. Right? Now, Chirag Goyal is saying digitalis. Absolutely right. Pulsus bigeminus is digitalis. Then TB, without TB, no NEETPG exam. Okay, doc? So, significant weight loss, इसका definition क्या होता है? What is significant weight loss? Statistically significant weight loss. Yes. I can see A versus B. कुछ लोग 5 के ऊपर दावा लगा रहे हैं, कुछ लोग 10 के ऊपर दावा लगा रहे हैं, right? Question number 17. That's right. So it is 5% is called significant, doctor. Oh, doctor. All of you are clean bold in this question. Ravi is right. Oh my God. That's right. Next, topic number 18. Right. HBV, HCV is the favorite topic of the examiner. Without that, there is no question paper. Padna padega. A person is having HbS-Ag negative, anti-HbS positive, anti-HbC positive. What is the most probable clinical diagnosis? Question number 8. Serology of hepatitis B के ऊपर अगर क्वेश्चन नहीं आए तो पूछना, definitely आएगा, and you have to give me correct, absolutely correct answer. Sudipti is proposing acute infection. Ismat is saying A. Shubham says B. Very good. Yes. So it says because HbS-Ag became negative, it says that the person had a immunity because of the infection, that is the inference. कोई बात नहीं, अगर ये क्वेश्चन जो आंसर रॉन्ग किए हैं, जसविंदर कौर and everybody, just give half an hour of your time tonight. I'm begging you. Go back to the U Medico app, go to the video library, high yield topics में है, AIMS में है, DNB में है, All India में है, JIPMER में है. All question banks are available along with the video discussion and notes. Please review in one of the banks this topic of hepatitis B, hepatitis C. Don't forget before you go to sleep if you have done this wrong, and definitely it will be rewarding tomorrow. Next question. Aphasia, sure short topic of the examiner. Wernicke's area lesion, what does it lead to? Is the question of the examiner. Tomorrow, definitely Wernicke क्या होता, Broca's क्या होता, conduction aphasia क्या होता? Definitely there will be a question, so you should definitely answer it. 161 online. So please tell your friends who missed this class. The last class for 2018 batch, from Monday onwards, they will be starting the cycle of the 792 hours of free coaching from Monday onwards for the next batch of students. Please tell your juniors who are writing their final year exams to come and enjoy this free session every day evening. And I'm very sure for all of you who attended in the last 2 months, it has helped you. Those who subscribed to the U Medico app, it has helped you. I hope so. Very good. I can see you're struggling between B and C, but fluency, but meaningless. Absolutely right. Meraki rightly says verbal diarrhea. That's right. Question topic number 20. Cauda equina versus conus pendularis is the favorite topic of the examiner. Early loss of the bladder control. किसमें होता है? A very early loss of the bladder control. Yes. Question number 20. Good. Rocket thinks Corda Equina. Most of you are thinking B. Dr. Ravi is thinking C. Corda Equina. Already we discussed this in one of our evening, glorious evening sessions. Corda Equina versus Conus medullaris. Wrong nahi karna. It is Conus medullaris is what you need to remember. Most of you who made it B, proud of you all. So, if you have done this wrong, no worries. Go back to the UMedico app video library, review it. Just invest half an hour of your time. It's worth. Okay. So let me know, doctor, what is your score? Very good. Shubham Gandhi, Kulkarni, Monica Sharma, 8 by 10 पे चल रहा है, right? Ismat, no heartbreak. 6 by 10 is also a good score. मैं बोल रहा हूँ ना, 2-3 topics पकड़ो, half an hour, 1 hour invest करो तेरा time. It is going to help you. Rocket Trader, that's my suggestion to you also, right? And Vanilla Danish, who scored 7 by 10, absolutely no worries. 1-2 topics कम से कम पढ़ो, अब 7 से 9 बन जाएगा, बढ़िया. Now, doctor, the question number 21, cyanosis, sure short topic of the examiner. Methemoglobinemia will result because of exposure to what? Question number 21. 21. The whole idea of quizzes which are free on the UMedico app is all high yield topics के ऊपर quizzes available है. एक topic ले लो, 8 by 10 आ गया आपको, 10 marks quizzes होता है, 8 by 10 आ गया छोड़ दो, 8 by 10 नहीं आया, फिर जाओ पढ़ो और फिर खेलो ताकि आपको फिर 8 by 10 मिल जाना. Then you can leave it. So that is the whole idea of the quizzes. I am so happy. 78,000 quizzes have been played by the students, and we are doing a data analytics on the quiz performances and going to analyze what kind of questions, what kind of topics people are really struggling while answering, and the next generation of students are going to be helped out by what their seniors have done and struggling in last year. So that is how artificial intelligence is important. It's going to help you. Very good. All of the above. Chirag Goyal, जरूर ये वीडियो रह जाएगा YouTube में as a memory. Why do we take videos and photos? For memory only, right? उस दिन 2019 जंग के पहले दिन, जंग के दिन के the day before the jang, we were all together as a congregation. We were all getting ready with a high adrenaline to go and blast the tomorrow's exam. 2019 is the year that you will mark in each of your calendar as a remarkable year where you joined your dream specialty of post-graduation. This is the memory that you need to carry, right? So, these are all the causes of methemoglobinemia, the list of causes. The next sure short topic, IBD. Let me see how good you are. That is not irritable, but inflammatory bowel disease. Ulcerative colitis versus Crohn's disease. Differences क्या होता है? 20 साल से हम देख रहे हैं एंट्रेंस को. हर एक साल विदाउट ए क्वेश्चन ऑन अल्सरेटिव वर्सेस क्रॉन्स पेपर होता ही नहीं, राइट? सो इस क्वेश्चन को आंसर मत करना, मैं रोऊंगा. वेरी गुड. अल्सरेटिव कोलाइटिस pseudopolyps. The next sure short topic is lung cancer. Let's see how good you are. Neuromuscular disorder is seen in which lung cancer? What type of neuromuscular disorder? Eaton-Lambert syndrome, where voltage-gated channels presynaptically are damaged by the autoantibodies produced as a paraneoplastic response of malignancy. Very good. Question number 23. I can see you divided between A versus B versus C, but majority are agreeing it is small cell cancer. Beautiful. Beautiful. The next, men syndrome के बिना नहीं होगा NEETPG. फटाफट बोलो बाबूजी, meant to be. All these things are seen in meant to be, except what? Question number 24. Let me check how good you are in this topic. Question number 24. Ritwik, Monica are proposing C versus A, or I can see most of you are on B. That's good. But who said A? Jaswinder Kaur, Jindabad. You find PO, medullary carcinoma, neuromas. Why do you find hyperparathyroidism? All you have to find in men, 1. Pituitary, parathyroid, pancreas is men 1, right? So, pituitary adenoma, parathyroid, pancreatic is men 1. Parathyroid, medullary carcinoma, and PO is men 2A. And mucosal neuromas, habitus, thyroid cancer, PO, they're all the men to be. So you can easily remember B is a big person, so marthenoid. And belly problems, that is mucosal neuromas. Then topic number 25, sure short topic. मैं लिखे दे देता हूं आपको. I will put on a blank check and tell you meningitis के बिना अगर क्वेश्चन पेपर है तो मुरली भरद्वाज, down, right? Definitely examiner is going to ask. Now, which mimics a space occupying lesion in the brain is a very important question. Question number 25. Yes. So, Rocket Trader, what is MEN-X? Any new syndrome? So, question number 25. I can see B versus A. Soumi Mandal is saying A. That's right. Kulkarni also. All of you are betting on A. That's right. Cerebral abscess. Easy question. Then topic number 26, myopathy. You should be ready. Otherwise, Tirupati. Right? Now, doctor. Creatinine phosphokinase. Where is it increased? Question number 26. CPK levels are increased in which situation? Very happy to see 195 students. Please tell your other friends also to join. I love to bid a farewell to you. Alvida कहना. That's what I'm looking forward for. And after the exam is over, I want to listen from all of you how you did, right? So, when we send our child, until 4 years, the child grows in the safe cocoon of the parent. First day when you drop your child in nursery class and come back to home, you will be actually won't come back to home. You will be going round and round the school only, thinking that मेरा बेटा क्या कर रहा है, करते रहेगा class में बोल के. Like that, I will be waiting for you as such. You have gone to the first day of your nursery tomorrow. Please come out and tell, hey, I'm very happy I cracked it. That's kind of a kid coming out of the school I want to see. No, mama, teacher is very angry, mama. No, not that kind of a kid. You're going to say, yes, I cracked it. I used my common sense. Left hand, left, right hand, left brain, right brain. Finally, I cracked 300 questions and came back. That's what you should say. Let me tell you. Winning is 98% confidence, doctor. Let me tell you. Only confidence. Carry yourself. Carry your soul. Carry your brain. Carry your spirit. Carry your confidence. Carry your trust on yourself. And that is a secret formula of winning. Let me tell you, it has no relation with the magnitude of what you read. Rather, it is a quality of usage of the brain. More gray cells, please use tomorrow. Right? Now, doctor, all of the above. Creatinine, phosphokinase. Now, the topic number 27. Pheochromocytoma is a favorite question. Without that, there is no paper. Surgery nahi to medicine, medicine nahi hai to physiology, physiology nahi hai to pharmacology. हर एक जगह PO है. Question number 27. Should your answer? Muhammad Mustafa Hussain is asking a question. Sir, how many questions to attempt? Come on, Dr. Muhammad. How many laddus to eat? Is it a question? Until your stomach can take it. नेगेटिव मार्किंग वाले पेपर में अंदाज लगाने के लिए you should be like a stock trader and attempt the questions. That's important. Okay. That's good. Most of you are saying D. Very good. Sweating attacks, weight loss, headaches. Why hypocalcemia? Absolutely right. Topic number 28. Sure short topic in medicine. Pneumoconiosis. What is true about pneumoconiosis? Should you answer, doctor? That's right. Commandant always is commandant. Fire as much as your enemy doesn't even wake up after death. That's right. Good word, good sentence. So, question number 28. Should you answer, doctor? Ravi is proposing C. That's good. I commandant. Absolutely. Prajakta Bhagat is saying C. Kulkarni thinks D. C, doctor. C. Absolutely. Simple question. Acidosis, smoking together is a double-edged sword. Abhi aa gaya. CR are diabetes insipidus. Whom do you remember? You will remember MB sir. Murali Bharadwaj is synonymous with Little syndrome, Bartter syndrome, Gentleman's, renal tubular acidosis, CR, diabetes insipidus. Wherever logic is involved, there we all have worked very well. Right? Now, central pontine myelinolysis is because of the rapid correction of what type of dyselectrolytemia? All of you should answer this correctly. No wrongs. Ravi, please don't make me cry. Kulkarni, please don't tell that. इतना हम पढ़ाने के बाद भी आप ऐसा बोले तो कैसे बढ़े? So very good, very good. Vipul, Swati, Balakrishna, everyone is right. Hyponatremia. So typically, Pons is the center of differentiation, and that is suffering from myelinolysis is what you need to appreciate. Now, the last sure short topic without that there is no question paper is CRF. Chronic renal failure, which is the entire story, you will become DM nephrology, right? Without that there is no question paper. Now tell me, question number 30. A low specific gravity in the urine, where do you see? That's right. Kulkarni says 2 silly mistakes. Excellent. So that means your apparent score is 7, but actual score can be 9. And if you 9 out of 10, and if you happen to prepare 3-4 more topics, 10 out of 10 aega, right? So that is the whole purpose. What is the purpose of a teacher? To hold your hand and tell you probably little correction here and there. Wahan thoda correct karo beta, idhar thoda correct karo. Then you yourself is very strong, doctor. That's right. So a low specific gravity in urine is a feature of insipidus, polyuria, polydipsia with polyuria, not in case of diabetes, right? Sai Maunika is asking, sir, are there any tips for avoiding very silly things? Boss, if a child says, आई एम जस्ट वॉकिंग, मुझे नहीं गिरने का कुछ टिप्स देता बोले तो, अरे गिरना है बेटा, गिरो मगर उठो, गिरो और उठो, गिरो और उठो. As you keep on गिरिंग, after some time, the number of times you fall will be less. That is a simple secret, right? So every evening, my job is what? To trip you down, so that you learn how to quickly get up. So that is the whole idea, right? Right. So that completes 30 questions. Very good. Shubham Gandhi, 9 by 10. 9 by 10. Excellent. Anybody else? Alex Seth is 8 by 10. 2 silly mistakes ले लो, 10 by 10. मगर कल silly नहीं रहना. Then Kulkarni 7 by 10. Maybe 2 silly mistakes is 9 by 10. So half an hour more investment in these 30 topics I told. आपको मिल जाएगा सीट, 10 by 10 आएगा, right? Very good, Ravi, 22 out of 30 is a wonderful score in general medicine. Proud of you, right? Now, doctor, comes the surgery. We'll take 30 questions. You all have energy? If you have energy, I too have energy to spend time, right? So, breast carcinoma. सर्जरी में 30 क्वेश्चंस में ब्रेस्ट के बिना पेपर नहीं रहेगा मेरे भाई. आप तो बी रेडी टू गो एंड अटैक द टॉपिक ऑफ ब्रेस्ट कैंसर. ओके, दैट्स गुड. Secondary deposits from carcinoma breast are commonest in which organ? It is a common organ, all blood, systemic, all circulation will go there. Which is that organ? I am seeing a lot of you thinking bone. Okay, bone. Okay, all of you say bone, huh? That's good. Absolutely right. We have a Bateson's vertebral venous plexus which enable breast metastasis to go to the bone. The sure shot topic for the tomorrow's NEETPG in surgery, salivary tumor. Salivary tumor इतना खास बूस सब्जेक्ट है कि अगर आप उसको इग्नोर करें तो आज ही रात आप यू मेडिको में इस टॉपिक का फटाफट हाफ एन आवर इन्वेस्ट योर टाइम, यू विल मेक इट, राइट? So I can see Ravi saying B, Maunika thinks D, Swati thinks A. Okay, yes. So it is the B, doctor. You need not sacrifice the facial nerve always. Ashwini Jindabad, Sudipti Jindabad, absolutely right answer. Even Chaitra Raj also. Now, the third sure shot topic in surgery is pancreatitis. What is the cause of the chronic tropical pancreatitis is my question to all of you. Simple question है, simple answer जवाब दे दो. Question number 3. Abhiraj Paul proposes A. Ravi thinks A. Aparna Nori thinks cassava. Chirag thinks C. Good, good. So cassava, classically, right? Classical answer. So steatorrhea, diabetes, abdominal pain, classical triad. You can see pancreatic calcification, which is a marker of chronicity of the pancreatitis, and cassava is implicated. Next, gallstone cholecystitis, cholecystectomy. Without that, no question paper in NEETPG. 70-year-old man with chest pain, diagnosed from coronary disease, and you have done ultrasound and gallstone was detected. What is the next appropriate management of this gallstone in this case is the examiner's favorite question. Question number 4. Yes. Question number 4. Everyone says D. Shubham thinks laparoscopic cholecystectomy. A good number are thinking B. That's right. Very good. Very good. So you should remember D. Wait and watch is the most appropriate scenario. So asymptomatic gallstones अगर दिखाए तो अगर आप ऑपरेट करना है तो what are the prerequisites? Asymptomatic. If he is diabetic or he is due to undergo a bariatric surgery for morbid obesity, they are all considered to be the important indications. Similarly, congenital hemolytic anemia cases, you need to. Post-transplant, immunosuppressed, increased risk of complications, increased risk of gallbladder cancer hai to agar large stone more than 3 centimeter hai to, they are all the prerequisites before you do the surgery. That's good. Soldier of Mewar has rightly said, wait and watch before you run the sword. Right? So, what are the prerequisites? अगर medical therapy करना है तो what are the prerequisites? वो radiolucent stone होना और size should be less than 1 centimeter, functioning gallbladder रहना, and there should not be any acute symptoms is what you have to remember. The next topic, without that, there is no question paper, NEETPG. Thyroid carcinoma. Let me listen from all of you. Question number 5. Thyroid carcinoma. So, thyroid carcinoma developing after long-standing goiter is typically seen where? Question number 5. Yes. Vipul Chaudhary, Ravi, Jaswinder, everyone is saying papillary. That's right. And Ritvik Karumuri is saying follicular. Okay. So, long-standing goiter में grow होना वाला thyroid cancer होता है follicular is what you need to remember. Now, radiation exposure अगर है तो आने वाला thyroid cancer होता है papillary. That's what you should remember. Now, the next sure short topic, without burns, there is no paper. If you are expecting and going to exam, be ready to get burns. So, let me see how good you will be. Most commonly used fluid if you want to treat a burns patient is which one? Let me see how good you will answer. Question number 6. Sudeepti thinks crystalloid. Jaswinder, Danish thinks saline. Swati thinks crystalloid. Most of you, except Prasad, is thinking crystalloid, saline. Good question. Crystalloid is the one, is what you have to remember. So, fluid resuscitation अगर करना है तो what is the indication? Children burns more than 10%, adult burns more than 15%. And 3 to 4 ml per kg per person burn with lactated ringer, of which half is given during the first 8 hours, remaining half over the subsequent 16 hours. Then topic number 7, shock. Neurogenic, cardiogenic, vasogenic. अगर shock का question wrong करे तो मैं हो जाऊंगा shock. What is the best way to control the external hemorrhage? Question number 7. Yes. What is the best way to control external hemorrhage? Yes. Everyone is saying, yay. That's goodo. Very goodo. Alexander also is saying, yay. So, it is the direct pressure is what you need to Remember. Topic number 8 is appendicitis. So, Mantrel score, easy question. Mantrel score is used for what? Question number 8. Where do you use Mantrel score? Ismat is thinking pancreatitis. Kulkarni thinks appendicitis. Most of you are thinking A versus B. Appendicitis, doctor. Many times we discuss. Alvarado score, where symptom signs and laboratory is being taken, right? Then topic 9 is hernia. Hernia. Without a question on hernia, paper nahi hota, right? Nihan's classification में type 3A क्या होगा? अभी साई मोनिका, you answer this correctly, no? MS general surgery seat दे दूंगा, right? Mitesh is asking a very innocent question. Tomorrow these questions are coming, sir. Oh, see, we are a commercial coaching, but we are not like that super duper marketing techniques, tricks of the commercial guys. हमारा फैकल्टी नेशनल फैकल्टी है, बुक ऑथर्स है. अरे भाई, बुक लिखना अलग होता है, पढ़ाना अलग होता है. डिफरेंट टैलेंट्स. इफ समबडी हैज बोथ ऑफ देम, ग्रेट. पढ़ाई कोई भी पढ़ा सकता है. लव होना है स्टूडेंट के ऊपर, बुक ऑथर होने की जरूरत नहीं है. सेकेंड, द टॉपर गॉट द सीट. द टॉपर गॉट द सीट. उसका इंटरव्यू देखो, हमारे पास कोचिंग लिया. Toppers will go to 4-5 coaching centers to attend the demos. आते आते वक्त वॉशरूम का इस्तेमाल करेगा. And we commercial institutes will say, हमारा टॉपर को देखो. And they're all very cooked questions. आपको सीट कैसे मिला? सर, आपका रेगुलरली क्लास अटेंड होने की वजह से हुआ. If you attend regularly the class of anybody in this world, you will get the seat. Let me tell you. But can you regularly attend is the question. So, doctor, what I am trying to say is, the winner is within you. आपके अंदर है, आपके अंदर बैठा हुआ है. उसको जागो, उसको बोलो, मेरे साथ आओ, कल मेरे साथ एग्जाम लिखो ना. मेरे अंदर का विनर. अगर आपके अंदर का विनर बाहर निकले तो nobody can stop you to become a superpower. Whether you sell tea, you can become a prime minister. Whether you are a unemployed man, you can become Alibaba's founder. किसके अंदर रहता है वो? आपके अंदर रहता है. उसको जागो, उसको don't disappoint him, don't curse him. That is what I want to tell you. That is the only secret to become topper. उद्धरेद आत्मन आत्मानम आत्मानम अवसाधे. आत्मैन आत्मनो बंधु आत्मैव रिपुरात्मनः. रिपुम बोले तो एनिमी. आत्मा का एनिमी होता है आत्मा. आत्मैन आत्मनो बंधु. द आत्मा इटसेल्फ इज द फ्रेंड ऑफ द आत्मा. सो आपके अंदर रहे हुए आत्मा को जागो और उनको बोलो, यू आर बोर्न टू बिकम एन एमडी, यू आर बोर्न टू बिकम एन एमएस, यू आर बोर्न टू बिकम ए कार्डियोथोरैसिक सर्जन. और वो कल जाके it will make you the topper. Let me tell you. So you all prepared well, doctors. Enjoy a nice fight and a good guesswork. Let me tell you, 150 questions guess मारने में आप number 1 रहना है. Okay? That's good. So Nihan's classification, direct inguinal hernia जाता है type 3M. Type 1 is indirect inguinal hernia, internal inguinal ring is normal. टाइप 2 होता है indirect inguinal hernia, internal inguinal ring is dilated but posterior inguinal wall is intact. टाइप 3 होता है posterior wall defect जिसमें direct inguinal hernia होता है. And type 4 is recurrent hernia is what you need to remember. So, splenectomy, topic number 10. Let us be very sure. Splenectomy. What is the most common infection in the post-splenectomy period is my question to all of you. So, very happy to see 197 online. Super duper. 10. Question number 10. Very good. Capsulated organism क्या होता है इसमें? Of course, there are two capsulated organisms. Most common क्या होता है? Question number 10. So, most of you are thinking on pneumococcal, which is absolutely right. Right? So, when you are planning splenectomy, at least 2 weeks before surgery, pneumococcal vaccination देना पड़ेगा. And booster of pneumococcal should be given every 5 to 6 years. Tell me, doctor, what is your score out of 10? 10 sure shot topics में आपका score कितना है? How many got 9 by 10? 8 by 10? Come on. How many of you, what are your scores? Very good. Sudeep, proud of you. 8 by 10, I am sure. Carry your soul. 10 out of 10 आएगा. Then Shubham Gandhi, 9 by 10. Swati, don't dishearten. Raat, out of this 10, जो भी 4 wrong किया है स्वाति तुमने, 6 out of 10 आया, वो 4 में से at least 2 topics ले लो, यू मेडिको में रिविजन करो और कल वो भी राइट करेगा, ठीक है? That's good. Now, varicose veins. What is the treatment of choice for a patient presenting with a venous ulcer with an incompetent perforator? Is my question to all of you. Question number 11. Should you answer, doctor? Ravi is saying saphenofemoral ligation. Vanilla also. And Maunika thinks subfacial ligation of perforators. Trendelenburg's procedure. Soldier of Newar to B to the power of 10 bol raha hai. Super, Monica, you will be really happy tomorrow's exam. I am very sure. You just said no. अगर पेपर ऐसा है तो हम फोड़ के फाड़ के आएंगे. हाँ, definitely. Paper will be like this only. Questions will not be the same. Topics will be the same. How good you are in the topic is all the story, right? So, saphenofemoral flush ligation, the stripping of the saphenous vein is the one which you will be using. The next short topic for the NEETPG 2019 is gastric cancer. About gastric cancer, what is accept is my question to all of you. 198, very good. 14 gave likes, 1 gave dislike, I know. Only when someone who can dislike you is there, that is a motivation to work. Let me tell you. Always, throughout my career, कोई बोलना है मुझे, क्या रे तू बकवास है बोल के बोले तो मजा आता और करने का मन लगता, right? So somebody who is disliked, I want to tell you that yes, sometimes it's a disappointment to accept certain reality and truth about where we are lagging behind. But the question is, you quickly sort out. The good news is, you quickly sort out where you are lagging behind. You still have time, right, to make it up, right? And that makes you to win. That's the whole purpose of this session, not to disappoint you. So that's right. Low socioeconomic class, H. pylori, vitamin C protects, they're all true. Large majority occur in the distal stomach is what you need to remember. Now, topic number 13. किडनी में स्टोन. अगर आप कल प्रैक्टिस करें तो every day you are day in and day out bread and butter in this country, which is a tropical country, hot country, is renal stone, is what you should be sure about. Staghorn calculi with protease infection. What does it basically contain? What does it basically contain is my question to all of you. Question number 13. Very good. Most of you are correct. Triple phosphate stones. So these are the Staghorn calculi. Tomorrow's examiner may give you a radiograph like this. Be very sure. Now, Soft tissue tumors. This is most ignored topic, but a favorite topic of the examiner. The most common retroperitoneal sarcoma. Which one it is? Question number 19 is my question to all of you. 19. That's right. Struitis with coffin lid appearance. Absolutely good. 19. I can see Ravi opening with fibrosarcoma. Saumi differing, saying liposarcoma. Roshan thinks Leo myosarcoma. So it is liposarcoma. Chaitra Raj Jindabad. Now, liposarcoma is the most common type of a retroperitoneal sarcoma, is what you should remember. Without a paper, without a question on surgical instruments, there is no question paper. NEETPG. एक picture देगा, examiner will check whether you attended OT or not. What is this instrument? गौर से देखो बाबूजी, दिल लगा के देखो बाबूजी, इस इंस्ट्रूमेंट को क्या कहते हैं? You recorded, right? Now tell me, what is that instrument called? Is it a cheetle or lane, Babcock, Ellie? क्या होता है? What is this instrument? Which you are able to see? फटाफट आंसर करो. That's right. Most of you are saying Alice, tissue forceps, and Ravi thinks it is cheetle. Okay. It is Alice tissue forceps is what you should not forget. So this is the Lane's tissue forceps. Lane's tissue forceps. Then this is cheetle. ऐसा रहता है. Ting ऐसा रहता है. Right? Okay. There's this little curvature. Now, out of the second 10, how many got? 9 by 10. फटाफट बोलो. Second over में कितना आया? Second over of 10 questions. हमारा एक over होता है 10 questions का. Right? You Medico app में भी 10 questions का एक over होता है. इस over में what is the scores? 8 by 10. Soldier of Mewar. Salute. Alam Raja. Salute. 10 by 10. Excellent, excellent, excellent. So, some subjects we have a natural inclination, right? That's right. I hope you all enjoyed Dr. Gautam, very vibrant teacher who teaches, and Dr. Vamshi is another cardiothoracic surgeon. He will also be teaching the next batch of students in our 792 hours of daily session across the year. I have given you a schedule and the video. Please share it to all your friends on WhatsApp, Facebook, everywhere, and make this session attended by 10,000, 20,000 students. That is the kind of audience we should have next year among your juniors. Please don't forget to encourage them to attend with us. Yes. So, question number 21. All these statements are true regarding renal transplantation except what? Yes. Very good. Even pediatrics teacher, Garmagaram sir होता है, Gopati Srinivas. Excellent. पहला प्यार रहना doctor. You should love the student. Tomorrow you also become junior residents. Love your house surgeons. Help them to make simple things like suturing, etc. Some questions share करो उनके साथ. The moment you are a teacher, then there begins the learning. Let me tell you, right? Even ENT sir Chandrasekhar also gave a wonderful time to you. We have an excellent gynecology obstetrics teacher, Dr. Apeksha Sharma. She is going to teach the next batch of students, and you will all be enjoying. I mean, those who are going to join. Yes. So, question number 21. Most of you are betting on A. That's right. This is the left kidney which is being preferred. Because it has a longer left renal vein is what need to be remembered. Then, that's the reason. Right kidney is not the right kidney to use for transplantation is what you need to remember. Zollinger-Ellison syndrome. Definitely one question is going to come. Should you answer, doctor? Zollinger-Ellison syndrome. Yes. Let me check your, let's see the questions. Gastrinoma, triangle ka, boundaries, all these things except what? Gastrinoma, triangle ka, boundaries. Question number 22. Yes. Ravi Kumar is saying B. Second and third? Yes. Nishchal is saying C. Very good. All our teachers are also texting. A good luck to all of you going for the exam. Right. And please tell what are those points that we discussed really came in the exam and helped you to answer correctly after this tomorrow's exam is over. Please do tell us your experiences. We love to help you. We love to feel proud and happy. Wow, these are all the points that really helped you, right? So it is a cystic duct and bile duct junction, second and third part, junction of head and neck pancreas, the gastrinoma triangle, which you should not forget. Right, doc? Then achalasia. Without that, there is no question paper. Corkscrew esophagus, where you see, is a very important question. Question number 23. So, our 2020 NEETPG ka session rose free, absolutely free YouTube session will be up to August 30. We will have a topic wise review discussion every day, and from September onwards every day chai pe charcha and a tambula, so that we prepare you every day one subject every day and ask us a set of questions on each topic, high yield topics, and then stimulate you. So this is going to be our journey in these free YouTube sessions. Currently we have 32,000 subscribers. Please make this popular by telling to your juniors and sub-juniors, even first year MBBS students in your reach, to get at least, my goal is at least we should have 3 lakh subscribers, 10 times the present subscribers, and that will be a great pride for all the teachers. Yes. Now, yes, most of you are saying diffuse esophageal spasm. Absolutely right. This is what you can see, a diffuse esophageal spasm. Blunt abdominal injury is the favorite question. What is the treatment for blunt trauma of the kidney? What do you want to do in the blunt trauma of the kidney? Question number 24. Yes. 24. Sai, Maunika, Chirag Goyal and Ashwini, let me tell you, in war or romance, better late than never. That is the rule. Okay. So at least we started in October and we had a good time. So you should remember, it is a conservative treatment, which is a management of choice. So renal injuries, how do you classify them, etc., etc. And 98% of all renal injuries can be managed conservatively. The next sure shot topic is esophageal cancer. Anything, everything, you should be ready. What are the most common site for the esophageal perforation is the question of the examiner. Right. Esophageal perforation. What are the most common site? Very good. Swati, Sudeepti, everyone is saying mid-esophagus. And Tiwari thinks cervical region. Tiwari, Jindabad, very good answer. Now, grafting is the favorite question. One question on Thier's graft, Wolf graft, full thickness graft, split thickness graft, everything you should be ready. Reconstruction of the tip of the nose after you remove a basal cell carcinoma. What type of graft do you want to use in order to manage it? Is the question of the examiner. Fatapat bolo. Question number 26. Garma garam answer. Very good. Yes, I can see most of you differing between A versus B. Soumya thinks it is bilobed flap. Soumya Jindabad, absolutely right. Convex defect, just like on the tip of the nose where convex defect is there, then bilobed flap. Now doc, neck injury, radical neck dissection. Favorite topic of the examiner. Fatapat bolo, a nerve is injured in radical neck dissection. It leads to the loss of sensation in the medial side of the arm. What is that nerve which is injured in the radical neck dissection? Should you answer, doctor? 27. Yes. Maunika, Ritvik, everyone is thinking medial cutaneous nerve of the arm. Absolutely right. Portal hypertension. Without that there is no paper. Denver's shunt is used for what? Denver shunt के नाम पे इस शंट को किस में इस्तेमाल करेगा आप? 28. Sudipti thinks ascites. All of you are thinking the same. Absolutely right. So the Denver shunt. Tomorrow examiner can give you a question, image based question like this. You should be quite sure. Renal cell carcinoma is the next very high yield topic. These are all seen in von Hippel-Lindau. Except what? Question number 29. Shoot your answer, doctor. Right? Von Hippel-Lindau syndrome. These are all seen except Ravi thinks gastric, Ritvik thinks renal cyst, Shubham also, Saumi also. No, renal cysts are classically seen. So gastric carcinoma is a one, which is not the part of it. Aortic dissection is a very sure short topic. Usme sure short question is what is the size of aneurysm at which you will do the surgery is the question. So question number 30. Right. So question number 30. Ravi proposes more than 5.5. Most of you. Even Devi also. But yeah, more than 5.5. So doc, give me quickly the news. 30 में 21 marks से ज़्यादा कितने लोगों को मिला? More than 21 out of 30. Overall, more than 21 out of 30. Very good. Devi got 10 by 10 in the last over. Excellent. Swati is on 21 by 30. Kulkarni on 23 by 10. 23 by 30. Yeah? Okay. 27 out of 30. Ravi तो MS जनरल सर्जरी बनने के लिए पैदा हुआ है. Alex said 25 by 30. That's right. Now, shall we have a small tambula on gynops before we say a good night and good luck for tomorrow? Gynops में 20 questions खेलेंगे, ठीक है? हाँ. So those who are on set 28 by 30, 25 by 30, 20 by 30, feel proud of yourself and go to sleep, and tomorrow you are going to make it, right? Sure short topic in gynops होता है carcinoma cervix. Without that there is no paper. Organism causing cervical carcinoma is which one? Question number 1. Easy question. Very easy question. Right? Excellent. Ravi is saying HPV means it is HPV. Next. Contraception. Without that there is no paper. Marina releases kitna micrograms of levonorgestrel per day is my question to all of you. Question number 2. Excellent. Ritvik thinks A. Ravi thinks 65. Tiwari thinks 55. फटाफट बोलो 10 का 30, 10 का 30, 10 का 30. Gulam Bhatt बोलेंगा 20. No, yeah, absolutely good. Gulam Bhatt, Jindabad. So this is the Mirena and it releases 20 micrograms per day. The next short topic, gestational trophoblastic tumors. Which type of trophoblastic tumor Worst prognosis will be there. Should your answer, doctor? Yes. Question number 192. Sorry, question number 3. Question number 3. Good. I can see Ravi thinking after spontaneous abortion, but most of you are on postpartum. Absolutely right. Now, one question on anatomy of female genital tract. Lower 1/5 of the vagina is formed from there. Question number 4. एक sure short answer दे दो for the sure short question. Number 4. Ritvik thinks urogenital sinus. Ravi thinks paramesomniferous duct. A versus B. Good. It is A, doctor. Urogenital sinus. Upper 3/4 from Mullerian. Lower 1/4 develops from urogenital sinus. Next. Ovulation. Alright. Whole gynecology depends on it, na? Without that, how can examiner can give a question paper? Right? Inhibin B levels. What do they typically this test of ovarian reserve? When do you want to do to get the good results? I can see B, day 3 by most of you. Absolutely right. So, FSH most commonly used day 3. Clomiphene citrate challenge test is on day 3. Serum inhibin B also day 3 is what you should remember. Physiological changes in pregnancy. Stroke volume क्या होगा, peripheral resistance क्या होगा, heart rate क्या होगा, सब कुछ you should remember. Fetus is most radiosensitive at what time of the gestation? अच्छा guess बनाओ डॉक्टर साहब, आपका अंदाज लगाओ. Yes. Chirag Goyal should not ask a question, innocent question. Give me the topic list. It is already there in UMedico app. Chirag, please download quiz. बोल के type करो. आपको पूरा subject wise quizzes मिलता. They are all organized in the descending order of priority. Top 30 topics. Okay. So I can see A versus B. 8 to 15 weeks. And a dose more than 5.1 gray before 18 weeks causes 100% fetal mortality. Dysfunctional uterine bleeding is a favorite topic of the examiner. एक neonate में vaginal bleeding हो रहा है. What do you want to do in this given scenario is the examiner's question, right? Yes. Question number 7. All of you are saying wait and watch. Don't do too much of gynecological acrobatics. Maternal estrogen के withdrawal के वजह से newborn baby में vaginal bleeding हो सकता, nothing to worry. Medical disorders in pregnancy, definitely one topic आएगा, one question आएगा. अगर मलेरिया हो गया pregnancy में, what is the drug of choice? Is a very, very question. Very, very important question. Good. I'm so happy 200 of you have come back on this last day evening. Yes. So, it is the chloroquine any day is safe for a pregnant woman. Ovarian tumor. Shoot shot tomorrow. Most common ovarian tumor is which one? Question number 9. Should you answer, doctor? Question number 9. Ravi thinks A, Ritvik thinks D. I can see Monica differing with B. Come on, such an easy question. So many differences. Sonia Radhakrishnan कहता है C. But answer is serous cystadenoma, doctor. Please don't do. Don't break my heart. Still, just go back to the ovarian tumor. Clear it. Clear the concepts in UMedico app. Suddenly you will definitely bag one more question. Let me tell you. Last moment may I am giving you secret to you that what is that secret? Examiner जरूर पूछेगा, and if you don't revise tonight, if you did this wrong, आप जरूर miss हो जाएगा एक point, right? हाँ. Most common are the epithelial tumors. 80% are benign. Is what you need to remember. Then serous cystadenoma is the most common cystic ovarian neoplasm, accounting for 50% of all ovarian tumors. Preterm labor, topic 10. Sai Monica, don't worry, आप Google में जाके serous cystadenoma is most common बोल के type करो. Hundreds of Google links you will get. Okay? So controversies are all typographic mistakes in the books, but you will find a lot of supporting evidences. What is the investigation of choice if you are suspecting post-datism is an important question. Question number 10. Yes. Post-datism. Yes. Good to see our number became 204. Very good. So, I can see most of you saying yay. Ultrasound. Absolutely right. अभी बताओ फर्स्ट ओवर में कितना है हमारा स्कोर्स? Let us ask the score master, self score master. How many of have answered in this first over of 10 questions in Dynops? Shoot short topics in NEETPG 2019 or any NEETPG. Swati at 7 by 7, 9 by 10 by Alexei. Excellent. देखो डॉक्टर कितना you're all in the academic excellence. वही confidence पे जाना कल एग्जाम को. Excellent. Now, topic number 11. Without this, there is no paper. Infertility. Most common site of fertilization कहाँ होता है? However, it is an easy question. Question number 11. What is the most common site for fertilization? Yes. I can see most of you saying ampulla. Absolutely right. Caesarean. One sizzling question आएगा कल. Indication of caesarean. If already there was a previous caesarean section, क्या होता है इसमें? Indication for caesarean after previous caesarean. So vaginal delivery after caesarean एक topic है. Caesarean after caesarean another topic है. You must know prerequisites and indications. I can see most of you saying contracted pelvis. Absolutely right. Previous two caesareans, scar dehiscence, previous classical caesarean or recurrent indications like CPD. Absolutely. Eclampsia, without that no paper. What is the specific treatment of pre-eclampsia is my question to all of you. Question number 13. Specific treatment, you should be sure. Yes. 13. Ravi thinks B. Lucky Singh thinks D. Lucky Singh from Ludhiana. Then Alek Seth says magnesium sulfate. Come on, Alek, you can't do such mistakes. Oh, specific treatment. I actually thought termination of pregnancy. The only cure is delivery of fetus. So, answer should be B, doctor. I think B is more likely answer. Yes. Yes. B should be the answer. Now, placenta is a definitely asked one definite question in the exam. Circumvallate placenta क्या होता है? Question number 14. Types of placenta, everything. If you do this wrong, go back and review the topic of placenta in the UMedico app. Question number 14. Yes. Ravi thinks fetal plate smaller than basal plate. Sakshi, everyone is saying the same. Absolutely right. So this is the classical appearance where this is the basal plate, chorionic plate, etc., and how circumvallate looks like. Now, doctor, uh, endometrial cancer. Don't forget. एक क्वेश्चन आएगा. Question number 15. Postmenopausal bleeding में what is the investigation of choice? Come on, shoot your answer, doctor. Yes. Investigation of choice. Postmenopausal bleeding. I can see B versus A versus C. Right. It is A. Who said YouTube game helper said A. Devi also said A. Absolutely. Fractional curettage, where you need to take both endometrial and cervical tissues. Hydramnios, causes and complications, favorite topic. How much amount of fluid, of amniotic fluid you expected 12 weeks of pregnancy? Question number 16. Amir Farooq, don't worry. Today is the most memorable evening for me, right? So this will remain until YouTube remains. We will keep it, no problemo. But please tell your friends that to subscribe for this channel so that they get the notice whenever the session is starting. Okay, एक bell sign है ना, उसको click करो. So I can see A versus C, 50 ml. 12 weeks 50, 20 weeks 400, 36 to 38 is 1 liter, Param is 600 to 800. Like a milkman, you should be ready, doctor. Kitna milk hai? Hysterectomy. Without that, there is no paper. Kalka, short topic. During hysterectomy, ureter is liable for injury at which location? Question number 17. Yes. Question number 17. Thank you. 37 students have made it. Likes. The number of views and number of likes. It is like a social media addiction. Even in airport, I will be checking. अरे ये video को तो 5,000 clicks आ गया. ये video को तो अरे क्यों 5 dislikes आ गया. Then I will be thinking. So please don't forget to put likes and tell all your friends to become part of this juniors, to become part of this everyday ongoing free program, right? So where it crosses the uterine artery, जब नदी को पार this side to that side it is going, that is the place where ureter get injured, is what you need to remember. Now menopause, topic number 18, short topic. About the menopause, what is your answer? What happens? What are the hormonal changes that happen? About the menopause, question number 18. Yes. Easy question. Ravi thinks, अरे come on Ravi, estrogen क्यों बढ़ेगा? हाँ, very good. All of you are saying increased FSH. Good. It is increased FSH. Ultrasound in obstetrics. Definitely a question आएगा कल. Best parameter if you want to estimate the age in the first trimester. What is that? Ultrasound. Definitely आएगा एक question. Do this wrong, go back to UMedico and quickly review this topic. So Swati, Kiran, Nilupar, everyone is saying crown rump length. Absolutely right. 8 to 12 weeks CRL, second trimester connected BPD, third trimester BPD plus head circumference plus the femoral length is what you need to remember. The last short topic, almost 80 topics I told you doctor, it is like an election सीट का सर्वे कंडक्ट करता है ना, CNN India and everybody like that. I'm telling you, all this 80 कल आएगा, and जहां जहां आप wrong किए, quickly do some corrections that will at least increase five more marks आप right करेगा because of attending today's session. I'm sure on that. Sure, doctor. About genital infection, what is true is my question to all of you. Genital infection, question number 20. Yes. Question number 20. Genital infection, right? And you know our helpline number, and after the exam is over, whatever the questions you can recall with the options, if you can send us to the WhatsApp number that is being given to you, that will help us to know whether we are coaching the people according to the requirement and expectation of the examiner or not. Right? Very important. So, question number 20. Absolutely. Monica, Danish, Abhiraj, you all rock this discussion, and it is clue cells are associated with Gardnerella vaginalis is what you need to remember. So, with this, I give my luck for rent to all of you, right? मैं मेरे luck को बोलूँगा, भाई, I'm generally a very lucky guy, let me tell you honestly. Reading very little, I topped the entrance exam. So I'll give you the luck. And you carry your common sense, you carry your soul, and every man is born with a purpose. And what is the purpose you are born with? You are born to become great surgeons, great physicians, great radiologists, etc. etc. वो जो अरमान होता है, वो ख्वाब जो है, उसके साथ go and fight, and I'm very sure you will make it in the tomorrow's exam, and we will once more meet on Monday evening freshly, and our first day of 2020 everyday evening session once more will start. Please tell your juniors to join. Good luck to all of you. Win and come back and tell me that हम करके दिखाएंगे. Thank you. Thank you to all of you.